Reimbursements for chronic care management are tied to CPT codes. At first glance, these codes can be confusing or intimidating, but here at ThoroughCare, we're here to get you through it. In this video, we'll break down everything you need to know about CPT codes for chronic care management so you can properly bill for this program and maximize your revenue. Hey there, this is Lauren with ThoroughCare. Here at ThoroughCare, we help groups just like yours to manage value-based programs like chronic care management. Knowing the billing codes for CCM will give you a better idea of what's expected by both your group and by Medicare. Understanding billing codes will also help you optimize your staff's capacity while increasing revenue. CPT codes for chronic care management will vary by the time spent with the patient throughout the calendar month. At times, it can also vary by who at your staff or at your group is providing services. There are 3 series of CCM codes that you'll need to be made aware of: CCM Non-Complex, Complex, and Physician-Driven codes. One major thing to consider when actually dropping these claims to your insurance carriers is that a series of CCM codes can only be billed once per calendar month. So, for example, you can't bill physician-driven codes with complex or non-complex codes. If you bill more than once, you run the risk of that claim being denied by the insurance. We here at ThoroughCare suggest you drop the claim with the highest reimbursement at the end of the calendar month. Another important aspect of chronic care management billing is to use at least 2 ICD-10 codes with that CPT code. This ICD-10 code will be tied to the conditions you are managing for the patient's CCM. So again, at least 2 ICD-10 codes are required for billing, but if you are managing more than 2, you will need an ICD-10 code for each condition managed. Let's start with the non-complex clinical staff CCM codes. Now, what exactly is clinical staff? We at ThoroughCare suggest that someone who is logging this time be at least a certified resource or higher. So think CMA, CNA, or anybody higher than that at your practice. Code 99490 you might be aware of. This code has been around since the dawn of the program in 2015 and has largely remained unchanged since then. 99490 takes into account 20 minutes of non-face-to-face or CCM time done by the clinical staff. The current national average reimbursement is around $62. Now, again, keep in mind it might vary in your area. There is also an add-on code now for code 99490, known as code 99439. 99439 is an add-on code for 99490 only, and it can be counted after an additional 20 minutes is acquired on top of the initial 20 minutes. This code can first be billed at 40 minutes, so you'll bill using code 99490 and 99439. Adding 99439 will add $47 of extra reimbursement on top of that initial 62. You can bill 99439 up to 2 times per calendar month, so either 40 or 60 minutes. So you'd simply bill 99490 and 99439 times 2. This adds another $47, and the total national average reimbursement will be around $156 for the 60 minutes of non-complex time. If you are a rural health clinic or federally qualified health center, you won't use those codes. You will simply bill code G0511. This is a general care coordination code. As an FQHC or RHC, this is the only code you can bill for chronic care management. G0511 is at least 20 minutes of non-face-to-face or CCM time, and even if you accrue 40, 60 plus minutes, you can only still bill G0511 one time per calendar month. The good news in 2022 that this reimbursement has been increased to $76.94. Now, let's move to CPT codes for complex CCM. Some of your patients might need more care than others, and some patients you might be managing 3, 4, or 5 plus conditions within a calendar month. In this case, you'll use the complex codes for 60 or 90 plus minutes. At 60 minutes of complex CCM, you're going to bill using code 99487. 99487 pays at a national average reimbursement of $132. Now, there is an add-on code to 99487 only using code 99489. 99489 is an additional 30 minutes of time on top of the initial 60 minutes of complex time. You can bill 99489 an unlimited time within the calendar month. So 90, 120, 150 plus minutes, you would simply add code 99489 on top of 99487. Code 99489 will pay $70 additional on top of the 99487 claim reimbursement. Now, at this point in the video, you may have noticed that we mentioned 60 minutes of time twice, one complex, one non-complex. So what do we do in this situation? Well, here at ThoroughCare, we suggest that you bill code 99490 plus 99439 times 2. Now, there are two reasons why we suggest that. The first is that, hey, it ultimately pays more. So you can see the differences in reimbursements here between the two codes. Also, using 99490 and 99437 times 2, you're taking the complexity of decision-making out of the equation. So many of our customers feel more comfortable at that point, even if they don't feel that their patient is a complex CCM patient. And finally, let's go over the CCM CPT codes for physician-driven CCM care. If your physicians are more hands-on or they spend non-face-to-face time with the patients while they're out of the office, you may want to bill for these codes. The first physician-driven CCM code you can bill for is at 30 minutes of physician-only time, and that is code 99491. Again, 30 minutes of physician time only can be counted toward this code. Currently, the national average reimbursement for 99491 is $83. New in 2022, there is a 30-minute add-on code, an additional 30 minutes on top of the initial 30 minutes, using code 99437. Again, this takes into account 30 minutes extra provider time on top of the first 30, and the national average reimbursement for this add-on code is $59. Now that you know more about the CPT codes for CCM, it might be time for you to find a software solution that can help you streamline the billing process. If you're interested in a care coordination software, you may want to check out our free buyer's guide that'll give you a better idea of what to look for when considering a CCM solution. It's a download on our website, and you can also see it in the links below. You can also check our Learning Center with clinician-written articles answering the questions that are most frequently asked to us here at ThoroughCare on a daily basis. If you have any questions, please feel free to comment below, and a ThoroughCare representative will reach out to you. Don't forget to subscribe and like this video. If there's anything else we can help you with, please feel free to reach out, and thanks for watching.